Back with Bobby and JJ Radio. We have a very, very awesome show about the Patient Institute. We have two great guests, Mr. Adam Ratner. He's a radiologist. He's also the chairman of the Patient Institute. He's also professor of medical humanity and radiology at the University of Texas Health Science Center, along with the beautiful young lady of Varda Ratner. She's the president and CEO of the Patient Institute. I want to say thank you guys very much for having some time to take away out of your busy schedule to hang out with us here at Bobby JJ Radio. I want to jump right into the Patient Institute. What is it? Why was it created? And all that kind of stuff.
Well, the Patient Institute is a 501c3 public charity, a nonprofit organization.
Sure.
And I'd like Adam to tell you why it was created. Well, I'll quickly tell you our mission is to empower patients and caregivers to effectively navigate the healthcare system. And we do that in several ways, but I think I'd like Adam to talk for a minute about, he's one of the co-founders and why he decided to create it.
Sure.
Well, many years ago, my father came to San Antonio to practice pediatric surgery. He was the first pediatric surgeon in South and Central Texas, way back in the early 60s. And he had a way for taking care of his patients and his patients' families that was amazing. There were other physicians who were like him, but as time has gone on, it's harder and harder for physicians to do what he was able to do for his patients and their families. And when he passed away in 2007, we set up the organization to both honor his memory and also to continue the work that he did for his patients and their families. As a radiologist, I work with other physicians and work with patients, but I found that I was getting phone calls from people all over the country, me, a radiologist in San Antonio, trying to help or basically calling out of desperation because they needed help navigating the healthcare system. Someone would call me and they'd say, Adam, you got to help me. My mom or my dad is in the hospital. They're very sick. They're getting worse. They have 5 doctors. They're taking 20 medications, and they look like they're going to die. Help. And after I got a few phone calls like that, I realized that there's a huge problem. And so when we set up the Patient Institute, that's what we decided we wanted to address.
So as far as the Patient Institute, what programs are you currently offering families and patients?
We provide educational programs. The ones we provide the most are taking control of your health care and how to talk to your doctor.
Let's start with taking control of your health care. What does that mean?
It means that you really need to be a partner with your physician, and you really need to have a primary care physician. That's one of the things we found with these families that would call Adam, was that the patient had a lot of specialists, but they didn't have one doctor in charge. And It's very important to have one doctor in charge, and you need to captain the ship of your healthcare voyage with that one physician, and you two coordinate all of your care.
So you feel that there's not a lot of communication between, let's say, a radiologist versus an anesthesiologist when it comes to a certain patient, and it's just everyone's just subcontracted to do what they're supposed to do.
Yeah, they're all working on their little part,
Sure.
and someone needs to tie it all together.
Sure.
And work with the patient as a partner, and also work with the patient's family. You know, some patients, for whatever reason, cannot necessarily advocate strongly for themselves. So sometimes it falls on other members of the family. I mean,
Right.
if you're an infant or if you're a very elderly person with a lot of impairments, you need your family members or friends or someone else to kick in and work with the primary physician to make sure that the best things are done.
Yeah, so we educate people and provide them tools on how to go about doing all of this.
So is this mostly education, like through pamphlets and literature and stuff
Literature,
like that?
pamphlets,
Now the video here, Bobby and JJ Radio.
workbook guides. We have a guide, a senior guide that we developed that we distribute for free, and it's like a 34-page large print for seniors.
Do you have a pop-up version for Bobby?
Or a hologram?
Yeah.
We need one. We need one. I like the 3D version.
Can you tell us the difference between Medicare and Medicaid?
Oh,
Ooh.
yeah.
I'm gonna leave
Well, I can
that
give you the short answer. They're both programs provided by different sections of the government to help fund medical care and other social needs. But Medicare primarily is designed for the elderly. and it's to provide health care for the elderly. Again, there are a few exceptions. There are some people who are a little younger than 65 who do qualify for Medicare if they have certain conditions. Medicaid is a program which is jointly funded by the state and the federal government, primarily to help indigent people get medical care. And in Texas, it's primarily, at least medical care is given to children and pregnant women under the Medicaid program.
So if someone wants to get more involved with this awesome organization, you can go to their website, patientinstitute.org. You can also email for more information at info@patientinstitute.org or call them directly at 210-862-1678. Again, that's 862-1678. We're going to take a quick break, but we're going to come back and talk more about how to talk to your doctor, also about the geriatric console. This is very important information. If you know anyone that is in need of help, either from infancy all the way to seniors, please stay tuned. We'll be right back with Bobby and JG Radio.